Today is September 14th, 2016. Kay Wagner is visiting with Dr. Mario Abellera, a retired Gunderson pathologist. Dr. Abellera started his practice at Gunderson in 1966 and retired in 2007, right,
Officially.
officially, but then did outreach work and has at least 35 years of practice with the Gunderson Health System.
I am R. for Rivellino, Mario Abellera, 84 years of age, originally from the Philippines, and came to this country in 1955. I was born and raised in the town of Binalunan, province of Pangasinan, and in the Philippines, where I obtained my elementary, intermediate, or middle school and high school education. My education at that time was interrupted during with the outbreak of World War II, which lasted from 1941 to 1944, and the Philippines was occupied by the Japanese Army. At the age of 16, after graduation from high school, I enrolled at the College of Liberal Arts, University of Santo Tomas, Manila, Philippines, where I obtained my degree in Associate in Arts, Pre-Medicine, for 2 years. And then I continued in the Faculty of Medicine and Surgery at the same university, that is University of Santo Tomas in Manila, and graduated with a degree of Doctor of Medicine following 5 years of medical school, which includes 1 year of rotating internship as required by the Philippine law. Now, I graduated in March 1955, and a few months after that, I took the medical board of the Philippines, and then I applied, or I started as a rotating intern for 1 year at the Sacred Heart Hospital in Spokane, Washington, starting July 1st, 1955. And in my second and third year, in the States that is, I started my residency in pathology. And since that time, I wasn't sure whether I'd be a clinical pathologist or anatomic pathologist. I took both branches of pathology for 2 years at the Pueblo State Hospital in Pueblo, Colorado. That's 1956 to 1958. From 1958 to 60, I took up a residency in anatomic pathology at Mount Sinai Hospital in Cleveland, Ohio, where Dr. Goldblatt was the head, whom I regard as who is well-known, world-renowned pathologist, particularly in his work on hypertension, he being the pioneer in renal hypertension. Now, I stayed there for 2 years. I worked at the Mount Sinai Hospital for 10 years. And that hospital was affiliated with the Case Western Reserve University School of Medicine, of which I was appointed as instructor in pathology and eventually adjunct clinical professor in pathology towards the later my later years. Now, when I was looking for a job in 1976, Dr. Goldblatt asked me if I wanted to go to La Crosse, Wisconsin, which I said, I don't know. I haven't heard of that town before. And then, of course, I mentioned that to my colleagues. And they told me, where are you going? And, you know, that's a frigid place. You're going to freeze to death there. So, I mean, I don't know. Anyway, anyhow, Dr. Goldblatt happens to know Dr. Newcomer, Kermit Newcomer, who is a student of his while studying at Case Western Reserve School of Medicine. And so he called Dr. Newcomer, and of course, Dr. Newcomer replied and told me if I want to come for interview, which I did, along with my wife. And of course, we were accorded really splendid hospitality while we were here, and the medical auxiliary were very happy to receive my wife and the wine and dine here and there and showed her all the highlights and nice points in La Crosse. And in the meantime, I was shown also to the hospital and introduced me to the different heads of the department who interviewed me. And it so happened at the time that my interest was in mammography. So I lectured for an hour on mammography, which was highly received. I met, of course, Dr. Overholt, who was the director of education and who really convinced me to come over. He was formerly the head in medicine in Walter Reed Army Medical Center and the Armed Forces Institute of Pathology, where I would mention later that I was there for 3 years. That building was in the campus of the Walter Reed, so he knows about the reputation as far as pathology is concerned of that institution. So, I stayed here. Okay, at the time that I joined the clinic, there were 105 members, physicians. I would be the 105th, I think. And in the department were Dr. Janis, late Dr. Janis, may he rest in peace, Dr. Virata, who unfortunately developed right hemiplegia, but he's still okay up to now. Calvayan, who I think probably passed away, he retired in Florida. And myself, so there were 4 of us. And at the time we were doing about 200 autopsies. Compared to now, I think the last time I checked, there's not even 10 or autopsies like that. I think the main reason why autopsy was, although it's a good, it's very good for teaching residents, but it gets so expensive, and not with no remuneration from the government. And I understand that one autopsy, I think, would cost about $1,500 or more. And all autopsies that we did here were free. So they thought it was not practical, to incur all those expenses. So the autopsies now are, instead of doing the entire autopsy like we used to do, they just do it organic, or was it autopsy directed, or organ directed, organ directed autopsy. So you just do a needle biopsy of the particular organ that the clinician is interested. Excuse me, instead of doing all the examination of all organs regardless. Now, one thing also that attracted me here is the high quality of the residency internship program, and of course the quality of the attending physicians themselves.
At the Cleveland Clinic, how is this the name of is it Norblood?
Goldblatt.
Okay, Goldblatt.
Goldblatt,
okay,
yeah.
All right. I just wanted to clarify that.
He was the main reason I went there, because of his fame. And to my surprise, in spite of his world-renowned fame, he is, to me, is very humble, very kind, and as a matter of fact, he was very fatherly to me. Very, very nice person.
And then, when you were the assistant pathologist at the Armed Forces Institute in D.C., is that where you met Dr. Overholt?
No.
No.
I met him here.
Okay.
Now, when I was assigned, or when I was employed at the Armed Forces Institute of Pathology, or AFIP, it's a very highly specialized pathology institution, world known, and all the difficult cases, rare cases, and interesting cases are sent in from all over the world, including here. So if you mention the word AFIP in pathology, you know that you're talking about really the pinnacle of pathology. And I was assigned, when I was there, I was assigned in pulmonary mediastinal ENT. The rest are also individually specialized, like one maybe just looking at skin pathology, bone pathology, GI pathology, breast pathology. They're highly specialized. And even before I left, my boss asked me if I wanted to stay, because he said, Mario, I'm retiring in a year or two, you can take my place. It's a very attractive place to stay. Once you're there, you become famous, because you will see all cases from all over the world. But then, I don't know, I prefer private practice. So I went back to Mount Sinai Hospital in Cleveland, where I worked for 10 years.
Did you have a particular mentor or role model?
Dr. Goldblatt.
Okay.
He is really my role model in pathology.
Were you married before you came to
Oh, okay. I'm sorry. While in Cleveland, I met my wife there, who happens to be a nurse in one of the hospitals. But then, both of us were under the exchange visitor program. And as such, we are only allowed 5 years to stay in this country. And if we want to be a permanent resident or immigrant, we have to leave the country for 2 years, either to your country of origin or to a friendly country. And we elected to go to Canada. So I took a third-year residency in anatomic pathology at the Jewish General Hospital in Montreal, where we got married. And from there, I spent another year in anatomic pathology. Oh, I'm sorry. I spent a year of fellowship in surgical pathology at the University of Western Ontario at the Victoria Hospital in London, Ontario. And then after that, I was allowed to come in by special parole visa sponsored by the Department of State, because and also of course by the Armed Forces Institute of Pathology.
When you were talking about the AFIP,
Yeah.
do they pay the cost for transport of the deceased to, if you're transporting somebody for an autopsy? I imagine they're picking up the cost.
No,
No?
we did also autopsy, but very rare. Mostly we deal with surgical specimens.
Okay.
Cases that are sent in for consultation or referral from all over the country here and all over the world. So you become really highly specialized in that. When I used to be in private practice here, let's say I would see a tumor of the thymus, maybe 3 or 5 cases a year. But when you are there, since everything is funneled to your section, if you are like where I was in mediastinal pathology, I was looking at thymus maybe sometimes every day or several cases a week. So you become highly specialized. And then suddenly you realize why some of the outside pathologists would misdiagnose thymoma, for instance, for another disease that resembles histologically. But you can, you can tell, you can recognize it. Once you're there, you can recognize easily what it is. But if you're not used to looking at it, like the outside pathologist, then it becomes difficult case.
If a family requests an autopsy, are you required or committed to doing that? Or what's the protocol?
Well, like I said, we don't do much in the way of autopsies at the FIP. It's more in the general hospital. And even here, when a family refers an autopsy here, we do it, or if it's a medical legal case, then we refer it to the coroner. We don't even do it. Coming from Cleveland, before I came here, I readily assimilated and was able to just work with everybody, because the 3 other pathologists that I mentioned were very nice, and we got together very nicely.
Dr. Janis graduated from South Dakota, I
Yeah, South Dakota, yeah. Yeah, he Dr. Janis, Berata, and the other pathologist, Kalfayan, were all excellent pathologists, and I really enjoyed working with them.
How many pathologists are currently at Gunderson?
Oh, I just heard now that when I left here, there were 6 of us. Now they're going to be 7. They just acquired 2 pathologists now. So there'll be 7.
Does everybody work on general cases, or is it specialized?
As far as I know, it's specialized too. Like when I was here, there was a time when I was the only one doing renal biopsies, which includes electron microscopy and immunofluorescence. And at the same time, my special interest also was in genitourinary system, which includes prostate, which I was at the time again, I was the only one doing it, and I formulated a template which facilitates and simplify the signing out of prostate tumors. I was also interested in dental and oral pathology, and in which I held regular conferences with residents of that department. Also, I have some conferences with renal staff, medical staff, and residents. And of course, I join or contribute to the regular medical conferences at the Overholt and Rasmus Center, including presenting interesting cases or in the clinical pathologic conference cases and so on. Now, in the way of publications, I have several publications, more than 10, I think, in collaboration with several of the staff here. And of course, I also presented some medical cases, interesting cases in some of the national conferences. As a matter of fact, one of the proudest moments really is when I presented a case of AIDS. Now, before that, I happened to do an autopsy on an AIDS patient here. And at that time, AIDS was not popular. It was just early discovered. So I presented this in one of the medical meetings at the Beijing Medical Center through an interpreter, of course. And at that time, there were some Chinese physicians who come over to the hotel. They bring their microscopes and let me look at some of their difficult or interesting cases. So that was an experience. And this was in the 70s, by the way, at which time China was still communist. And all you see there, excuse me, are multitudes of people dressed in black. They're all dressed in black with that turtleneck thing. And riding bicycles, millions of bicycles. There are very few cars, and most of them are really owned by the officials. Although most of those cars are not really, most of them are old. There were no hotels like now. Buildings were old. We're still really pure Chinese, communist China, So, but it was a nice medical tour that we made there.
Did you see many patients, or were you?
While in China?
No, in your general practice.
Oh, well, no. See, that's one thing in pathology.
Mm-hmm.
We don't deal with patients, we deal with doctors. Mm-hmm. Whatever the doctor or surgeons particularly send us, or whatever, when the patient are sent to us, it's only specimens, not we report to the doctor, and the doctor in turns talk to the patient.
What have been some of the biggest innovations in pathology?
Okay, there are, since I was here, there's many modern, high-tech, advanced instruments that were acquired in the laboratory pathology that made us possible, or made the pathologists possible to read a case, for instance, or read the slides from the previous day in the following morning or before noon, whereas before we can only report cases maybe after 1.5 days to 2 days. So now we can even sign out cases that were done or biopsied today in the same day, because of these machines, which are really high-tech machines. And another thing that helped tremendously the pathologists now are the physician's assistants, of which there are 2 in pathology now. And they do all the grossing and routine specimens, which would otherwise be spent by pathologists the whole day. So now the pathologist really is doing mostly reading slides, diagnosing, doing whatever is necessary to arrive at a diagnosis. Very rarely do any gross. The interesting cases which the physician assistants may need their help, then they have to maybe direct them to the specific area to sample in their gross examination.
Isn't pathology the longest residency?
Not necessarily now. Okay, my residency in anatomic pathology is 4 years. And if you want to take additional, which I did, 1 year of fellowship, 5 years, or you can take 2 if you want more. Now, in other residencies, they're just as long. I don't know that how many years of extra residency required in other specialties. So it depends upon really. But averagely, I think 4 to 5 years, the residencies.
Is pathology a specialty where there's recruitment problems?
Well, speaking of recruitment, at least when I was still working, there is a great need. There is a dire need for pathologists, up to 5 to 10,000, I think. And from what I know before I left, there are not very many physicians taking up pathology residency, which makes it more acute need in pathology. So I don't know now whether they have overcome the shortness, the short demand, the demand in pathology. It can be, of course, now, I don't know, it could be the financial aspect of it compared to other specialties, like surgery or neurosurgery or cardiovascular, those things. I mean, comparatively speaking, they are higher, there are more compensation in those specialties. So it depends upon what you really want.
Were you on call? I mean,
yeah. We take turns in taking calls. Like I will be on call in surgical path, which means I'll be doing frozen sections for that week. Following week, I'll be on call on autopsy, doing all autopsies. And then the third week would be miscellaneous, meaning I can be doing anything. So yeah, we make rotations.
Did you serve in any administrative roles at the clinic and hospital?
No, I didn't serve any administrative role or research. I just did mostly the attend the regular or present at the regular conferences in most of the specialties, renal, oral, or respiratory. It depends upon which specialty need us go to for their conferences. Well, aside from the presentations that I made at the national meetings and publications that I mentioned, that's it. No administrative job.
Well, I think in 1994 you were elected to membership in the American Society for Ultrastructural Pathology.
Okay.
That had really only 180 members
Right. Yeah.
worldwide.
Yeah. I was in fact I was still a member up to the time I retired, and before that, of course, I was a fellow of the College of American Pathologists and American Society of Clinical Pathologists. I also joined as a member of the American Dental and Oral Association, and I think that's about it. Oh, when I was at the FIP, I was a member of the American Military Surgeons, while at the FIP.
It must have been helpful and educational for the residents that we have a dental, oral surgery residency here.
Oh yeah, yeah.
Yeah.
When I left, Dr.
Bonasic?
Dr. Banasik was the chairman when I was active. But then when I left, Dr. Strait took over the conferences for the oral and dental surgery.
The electron microscope has been in
Oh.
existence since the early 1930s and was used in research. It's only in the last 10 to 20 years that it's been particularly utilized in diagnostic pathology. How was it used here?
Oh, it was used. Like I said, I was well, before me, there was a pathologist who was doing electron microscopy. Then he left, so I took over, and we use it diagnostically, but mostly in renal biopsies, which is essential in the diagnosis of renal diseases, including immunofluorescence microscopy. And for that, I arranged regular conferences with the nephrologists and the residents of that specialty.
I also read that it was useful in recognizing parasites that are wasting away in AIDS patients.
Yeah, AIDS, of course, when I was early discovered, was kind of, well, I don't know how many autopsies we did on AIDS here, but I think I'll not be surprised if I'm the only one who really did a complete AIDS autopsy. And I know that I wasn't. Of course I tried to do all the necessary precautions at the time, at least. Electron microscope wasn't cost effective anymore. We're just even in the expenses and cases that we get, and in some, to a certain extent, losing some. So they figured, well, we might as well just send our cases to Mayo Clinic. And so they donated the electron microscope to the UWL here in La Crosse for research.
I'm just looking here. I don't want to ask questions that you've already answered. So let's move to the thinking back to your tenure at Gunderson.
Yeah.
What would your colleagues say that you're known for?
Well, as I mentioned, those in the field of electron microscopy, immunofluorescence, and prostate pathology, those are the three main things that I really was doing it by myself. And of course, all the cases, they give it to me, all those cases related to that. And vice versa, if I have cases of skin, I give it Dr. Janice, or OBGYN, I give it Dr. Verata. So we have his own interest and specialty. So we just finally to Weber is doing that kind of pathology.
Do you have a favorite story about Gunderson? Or maybe even a case?
Well, it's not exactly a story, but I remember one New Year's Day, I was on call, and I did 3 forensic pathology or medical legal cases and 2 regular in one day. So I spent my whole day in the autopsy room, and especially medical legal autopsies, and I know Jay knows about this. I take lots of pictures for medical legal cases because you never know what they're asking, when it comes to when it goes to court. Which reminds me, this is another thing that I remember. I did a battered baby case, which went to court in Decorah, and I referred this case to Dr. Huntington, who happens to be the forensic pathologist in Madison. And so we went together in court in Dakota. And while he was testifying, the defense attorney, of course, was questioning, is it possible, doctor, that the baby was being a battered case? He has all kinds of bruises, hematomas all over his body, with fractures in the head and in the bones. And so the defense attorney said, is it possible, doctor, to Dr. Huntington, that the baby maybe fell down in the stairway or fell down from the chair, to produce. And of course he said, oh, it's possible, but not probable. And then again he said, it's possible. Every time he asked him a question, he said, possible. So finally Dr. Huntington said, Mr. Counsel, it is possible even right at this moment for a bomb to just fail right in the court. I mean, he said, everything is possible. Mm-hmm. And of course, that's usually how they get you, when they say possible. Once you say it's possible, then they try to hammer you on that point. like he said, everything is possible, even a bomb can fail right here. And so that ends the question.
If you could change one thing in your years of practice?
Oh, I probably wouldn't change anything. I'll do the same, especially having practice here.
Do you have any advice or words of wisdom to offer a young physician?
Okay, I'll touch on that. Before I conclude, I'd like just to say that it has been a great pleasure and privilege to work in this institution, having worked for more than 35 valuable and memorable years. And during that time, I have really witnessed the phenomenal and progressive growth of this institution, culminating, as you probably know, in its present status as one of the top 100 hospitals in the nation, with its up-to-date and state-of-the-art facilities and equipment, and supported by top-notch and high-quality physicians, of which I'm proud to be associated with. I spent the greater part and best years of my life at Gunderson in particular, and La Crosse in general. And I'm very happy and proud for having raised my family and kids in this beautiful city of La Crosse. That's another thing. I'm really very proud of my kids. 3 kids. The oldest is Michael, 55 years old now, living in Chicago with 2 daughters, the oldest being. She's graduating as a lawyer at the Loyola University, and the youngest graduated at Iowa City, working as a TV commercial advertising, similar to what my second son, Mark, who is now in New York and is a creative and art director of his own company, which he recently incorporated, doing mostly TV commercials. And the latest one being, I'm sure you saw it, is Lincoln commercial. Now my youngest daughter lives in Minneapolis. By the way, my second son is 50 years old, still a bachelor, by the way. confirmed bachelor probably. And my youngest daughter, 48, lives with her husband in nurse, and have two daughters, 12 and 9 years old.
And the Iowa City, you have 4 children?
Three.
Three.
One in Chicago, a equity trader at the UBS. The second, as I mentioned, is a creative art director for TV commercials in New York. And the youngest, by the way, has 2 masters in family, in child therapy and education. And is working now as a psychologist and social work at the Hennepin County in Minneapolis.
Do you get to see them often?
I see Michelle from Minneapolis more often than the one in Chicago, which is 4 hours, of course, from here. But then, Mark, who lives in New York, at least once or twice a year, and luckily, we are going there for a week, first week of October. And only because he's coming here in Minneapolis, he's coming to Minneapolis, he's a golfer, avid golfer, to witness the Ryder Cup, I think. So he wants to, we thought, well, when you go back to New York, we take advantage, since I haven't traveled since I had this. Since you take advantage of flying with him to accompany me at least. But then going home is okay, because then Michelle is in Minneapolis to meet us there. And he usually drives us to right across, and then he can go back to Minneapolis.
Have you got anything else you'd like to add?
Something, yeah. I like to extend my deep gratitude to the medical media and its wonderful staff for their cooperation and support while I was here, and which made my work much easier and enjoyable. Thank you.
Thank you.
Thank you for your pleasant interview.
Do you have any advice or words of wisdom to offer a young physician entering pathology or medicine in general today?
As regards the advice to young physicians and pathology as well, in spite of the fact that we don't have any residency in pathology, is the following. Keep up the good work and take advantage of the superior quality, expertise, and experience of the high caliber and dedicated medical staff of which I'm proud to belong at one point. And to all physicians, including the attending physicians and outside physicians in La Crosse, just remember the following. Gunderson is the place to send your worst patients. Thank you, and God bless.